Hi everyone, this is Debbie Ford. My investigation looks at increasing the frequency of communicative functions of initiating conversations, seeking information, and responding to peers. My research question is as follows. Will aided language stimulation of pragmatically organized dynamic display, or POD, increase the frequency across behaviors of initiating conversations, seeking information, and responding to peers in a preschool student, ages 3 to 5 years of age, who is nonverbal and has a diagnosis of autism spectrum disorder? My research claim: expectation, greater frequency of communicative functions, evidenced by ability to discriminate between picture symbols during choice-making activities. The participant is a 4-year-old male student with a diagnosis of autism spectrum disorder who is nonverbal and receives speech-language therapy services as a related service as part of his educational curriculum. Participants with a cognitive score below 50, history of traumatic brain injury, and previous exposure to POD were excluded from this investigation. This investigation was conducted at an exclusive setting, special education, public school. Sessions were conducted by a district-employed speech-language pathologist in a preschool classroom setting containing the participant, other students, our classroom teacher, and 2 paraprofessionals. The intervention was applied across behaviors in 3 phases, each behavior its own phase, to isolate results to application of the intervention. Aided language stimulation by a licensed and certified speech-language pathologist utilizing a 12-per-page POD communication system establishing an independent variable. Intervention sessions of 15 minutes, 5 sessions per week were initiated. Independent baselines were established and maintained for each targeted behavior prior to initiation of the intervention for each targeted behavior. The first phase, dependent variable 1, of initiating conversations continued until the criterion level of 4 communicative functions were mastered. The second phase, dependent variable 2, of seeking information was initiated after the criterion of phase 1 was mastered, achieving 4 communicative functions of the targeted behavior. The third phase, dependent variable 3, of responding to peers, was initiated after the criterion of phase 2 was mastered, achieving 4 communicative functions of the targeted behavior. The results for the multiple baseline across behaviors design. Given the research question, independent and dependent variables, it was anticipated that the students' communicative functions would increase given aided language stimulation of POD when compared to baselines. Effective baseline data were obtained across 5 sessions, and an increase in behaviors was demonstrated after intervention targeted each independent behavior. Intervention phases, only initiated after each criterion was mastered, captured an increase over time of demonstrated communicative functions ranging from 2 to 5 functions per targeted behavior. Frequency of targeted behaviors continued to increase with minimal maintenance of intervention. The data were supportive of the claim that a student with autism spectrum disorder demonstrated an increase in targeted communicative functions across behaviors of initiating conversations, seeking information, and responding to peers when provided aided language stimulation of POD. The null hypothesis was rejected. Future research. Additional studies that demonstrated the effects of aided language stimulation of POD across individuals with communication disorders outside of autism spectrum disorder would be advantageous. Larger scale investigations that focused on frequency and variety of communicative functions would also be essential to sufficiently address the research question. In addition, communicative functions outside of the three addressed in this investigation should also be addressed in order to truly determine the effects of POD on functional communication. Abstract. The purpose of this investigation was to determine if intervention focusing on aided language stimulation of POD would increase the frequency of the student's communicative function attempts of initiating conversations, seeking information, and responding to peers. The subject is a 4-year-old male with autism. The materials utilized was a preschool 12 per page POD communication matrix. The procedure aided language modeling of the 12 per page preschool POD by a licensed and American Speech Language Association certified speech language pathologist, calculated the student's communicative function attempts utilizing the communication matrix. The communication matrix defines and labels communicative intentions, including those that come in the form of augmentative and alternative communication. The table earlier illustrated that the treatment intervention was beneficial as multiple baselines were maintained across behaviors until the intervention was initiated after criterion was reached for each phase and behavior, initiating conversations, seeking information, and responding to peers. Results. Criterion levels were achieved, and a positive trend of student achievement was noted during the intervention phases of each behavior and maintained with minimal application of intervention.